It turns out not all female ejaculation is the same. Why can one woman release a large volume of fluid while another only experiences a few drops? Is it your technique that really determines whether or not she squirts? Or is it something physical or anatomical that determines or allows someone to squirt? And is it a result of a physical trait that women have? What do professionals know about squirting that beginners don't? And of course, how can you make her walls quiver, shake, and squirt if it's something that you both want? Well, I'm Dr. Rachel Ross, physician, sexologist, and founder of the Dr. Rachel Institute. And in this video, we'll answer all of those questions and more. And actually, subscribing to the channel is 50% of mastering the right technique, so don't forget to hit that subscribe button. Now, when it comes to squirting, there's a fascinating combination and interplay of anatomy, physiology, and technique at play here. And before you can truly understand it, you have to know what's happening inside the body when someone squirts. So here's what happens. There's a pair of glands or openings called the Skene's glands. These small structures are located surrounding the urethra, and they're often referred to as the female prostate. Fluid is actually expelled or squirted from these glands. Now, the Skene glands are filled with tiny ducts that open into the urethra, and they produce a fluid that is similar in composition to the fluid produced by the male prostate gland, the prostatic fluid. So when a woman is highly aroused, a surge of blood flows to the clitoris and the two branches of the clitoris, known as the crura, along with the head of the clitoris. All of these dramatically increase in size, and an area known as the G-spot, which is really just a portion of the clitoris, swells with the fluid as well. The tissues swell, the Skene glands fill up, and sensitivity skyrockets. This pressure keeps building until those orgasmic and rhythmic contractions propel the fluid out through the glands and through the urethra, or the P-tube. So now that you understand how squirting happens, you ask, well, why is it that one woman may release a large gush while another experiences only a few drops? Well, the ability to squirt boils down to four main factors. First, it's the anatomy. The size and the capacity of her Skene glands can vary dramatically from one woman to another. Plain and simple. Next, it's the arousal level. The longer and more intensely she's actually stimulated in the area that corresponds to that G-spot, which is on the upper roof of the vaginal canal, then the more engorged and full those Skene's glands become. Then there's muscle coordination. Now, a powerful release happens when those pelvic floor muscles contract rhythmically and she's relaxed enough to let go. So some women who think, hey, I've never squirted, may actually have ejaculated, but the fluid escapes in small amounts, mixes with natural lubrication, and really kind of goes unnoticed. Just seems like regular day. And in principle, any woman who has experienced an orgasm can also have a squirting orgasm. In fact, in a survey of more than 1,200 women in the United States and Canada, about 40% admitted that they had experienced ejaculation. Now, this means that we can assume that if none of them were lying, roughly 40% of American and Canadian women are capable of squirting. So usually for a woman to experience squirting, there's really one condition that has to be in place. She has to be able to have an orgasm, because squirting requires that extremely intense buildup followed by that letting go. So I'll explain to you how you can assist in making that happen, because usually partners struggle. I think they think that making a woman squirt is just about finding that G-spot and rubbing it like it's a genie in the bottle. But here's the truth. That's beginner level thinking. See, pros know their anatomy and understand that there's a whole different game going on underneath the surface. Playing a role in squirting, it's not just the technique, it's the setup. It is the mental state of both you and your partner. See, beginners rush in with their hands and their toys, thinking that speed is the magic key, but pros, they know that in order for any squirting action to take place, a woman has to feel first safe and open before she's even willing to let go. That means trust, teasing, and building an atmosphere where she actually has the capacity to surrender completely to the moment has to happen. You have to understand that a woman becomes aroused not only physically, but also mentally. And being mentally turned on and relaxed often plays a bigger role than physical arousal when it comes to this. So, If relaxed and at the same time mentally turned on, then even if your technique isn't 100% perfect, she may still squirt. But stimulation should be a slow burn, like bringing water to a boil. You don't crank up the heat to the max right away and hope for the best. It'll burn. You start slowly, let the warmth spread, then you gradually turn it up. You got a simmer, then a bubble, then a boil. And then once the pressure's built up to the perfect point, you lock in that steady, intense heat and keep it there until the moment explodes. Angle and depth aren't minor details. They are the entire game. Some men and even some physicians even still think the clitoris is just that tiny little pearl on the outside. But you know what? That's honestly like believing an iceberg is only what you see on the surface. It's really a massive structure that extends deep inside, wrapping around the vaginal canal like a wishbone. And here's where the beginners blow it. They do the jackrabbit. Do you know what the jackrabbit is? The strategy is just thrusting straight in and out. Then they pick up speed, hoping for magic. But the pros, they know the real hot spot is on the upper wall, about 2 to 3 inches inside, angled up. That's where the internal arms of the clitoris split to form the G-spot. The magic is within the walls. You don't just jab at it. You angle yourself so that every moment glides and presses upward into that sweet spot. Think of it like waves, like strokes to scoop her from the inside, making gliding contact with the roof every single time. So now let's really talk about the technique itself, because squirting can be achieved using your penis, your fingers, your toys, your partner's fingers. Make sure you start this whole journey by calculating your erection age. It's a quick quiz designed to tell you if your erection is aging out faster than you are. Plus, I give you a plan on how to e-age in reverse. So head over to eage.me and calculate your erection age right now. I've pinned the link in the comments, or you can actually just scan this QR code right here on the screen. It'll take you right to it. All right, so we've discussed the anatomy behind squirting and how it happens. Now let's talk about the in-person technique and move away from the mechanics, and let's talk strategy. So let's say you've done all the things: the hugging, the kissing, the rubbing, the licking, the talking, the caressing. So she's turned on it at her peak. She's practically begging for it. Now, boom, this is when I want you to move in on stimulating that very special spot that triggers squirting. But don't just dive in too fast or too deep. The key isn't speed, it's precision. You're not trying to go deep, you're trying to kind of move upwards. The G-spot is an area on the front wall if she's standing up, the top if she's on her back, just a few inches inside. So before anything else, you need a position that allows you to hit your angle, not straight ahead, your angle. So here's this really strategic setup. I want you to take a pillow and slide it underneath her hips if she's on her back. Now this way, every stroke naturally glides along the upper wall because she's elevated. And here's a pro plus move. Now I want you to use your hand to feel the love on the outside too. Inside, it's a gliding, scooping upward motions, not jabbing forward, mixed with that rhythmic rub that I want you to do on the mons pubic. That's where the pubic hair grows, and on the clitoris. See, manually stimulating the head of the clitoris and the mons pubis will lead that G-spot to swell, those skin glands to become engorged with fluid. And now once you've got your angle, you lock that rhythm in, lock it in. You have to do rhythmic controlled movements, about half the depth, gliding along that same spot every single time, because each stroke should follow the same rhythm. Consistency is king. And when she responds, as her breathing changes, her hips tilt towards you, that means you're doing it right. So here's the thing. Don't speed up when she's close. When she's at the point where her muscles are clenching and she's breathing in waves, keep that rhythm the exact same, the same angle, the same depth, the same pressure. That's when the buildup causes the squirting release to happen naturally. If she feels the urge to urinate, it's not pee. It's not. That's ejaculate. That's it. That's the sign. Encourage her to let go. Squirting can happen with fingers, toys, or a live erection. In order to maintain stiffness long enough to get her there, watch my next video. Stiffen up the natural way, this smoothie recipe that will keep your erection strong and hard. I'm Dr. Rachel, and boom, I'm out.